Hello, and welcome to our presentation today. Today we will go over provider education on primary care provider, PCP, referrals, pre-certification, and policies.
Disclaimer. This information release is the property of Blue Cross Blue Shield of North Dakota Medicaid Expansion. This information is provided as is without the expressed or implied warranty. While all information in this document is believed to be correct at the time of writing, this document is for educational purposes only and does not purport to provide legal advice. All models and methodologies and guidelines are undergoing continuous improvements and modifications by Blue Cross Blue Shield of North Dakota Medicaid Expansion. The most current edition of this information contained in this release can be found on the Blue Cross Blue Shield of North Dakota Medicaid Expansion provider website at www.bcbsnd.com/providers. All rights are reserved.
At the time of enrollment, the member will have a primary care provider, PCP, assigned. The PCP provides and manages the member's care and also assists in coordinating the member's care with out-of-network specialists and other healthcare providers. The PCP is the member's point of access for preventative care or an illness and may treat the member directly, refer the member to a specialist, or admit the member to a hospital. The member can request their PCP or change their PCP by finding another PCP using the North Dakota Medicaid Expansion Directory of network providers at www.bcbsnd.com/members/find-a-doctor or by contacting member services at the toll-free number listed on the back of the identification card. All services must be obtained from a network provider to be eligible for payment as a covered service. Referrals are not required if the member is seeing providers in their selected in-network PCP. This will apply to all providers and specialists. PCP referrals for an out-of-network service. The PCP is responsible for submitting a medical review request for an out-of-network service. The following guidelines apply to referrals for an out-of-network service. PCP must submit medical review requests through the Availity Provider portal. PCP must notify the enrolled member of the medical referral status in a timely manner. Referrals do not guarantee payment of benefits. PCP may not request referrals for services that are available through a network provider. PCP referral exceptions. Services received from an out-of-network provider will not be covered unless one of the following exceptions exists: emergency services, family planning services, women's routine and preventative health care services, new members who receive covered services the first 30 days after enrolling in Medicaid Expansion, maternity services, or authorized referral is obtained from BCBSND when access to a network provider is not available or feasible. Emergency services are reimbursed at the in-network level. Referrals are not required. Providers must complete the online Medicaid Expansion ER admission notification form for any member who visited the ER/ED and was discharged, not admitted to the hospital. The online form is found at www.bcbsnd.com/providers. PCP non-covered services. If the member receives services not covered under the benefit plan, the healthcare provider must bill the member for the entire cost of the visit if the member is given advance notice prior to receiving the service. Member-demanded services providers accept BCBS/ND payment for covered services as payment in full. Members should not be billed for any services unless the member chooses to have a non-covered service or receive covered services from an out-of-network provider. In both situations, the member must be notified in advance with an advanced member notice, AMN, also known as a waiver agreeing to pay for the services. Coordinated Service Programs, CSP. BCBSND will work with enrolled members to ensure their healthcare services match their medical needs. If members are using healthcare services at a frequency or amount that is not medically appropriate and necessary, they may be placed in a CSP so the healthcare services they receive don't exceed generally accepted medical standards. Members are restricted to one provider. This requires a referral to see any other provider than their assigned CSP. Referrals are completed in Availity through the pre-certification tool. Review is done by BCBSND in consultation with the NDDHS. The following criteria are used to determine if the CSP is appropriate. Seriousness of incorrect, improper, or excessive use of services, historical utilization of the member, and availability of a coordinated service physician. CSP written notice. When a member is placed in the CSP, BCBSND provides written notice to the member, which includes reason why the member is being placed on the CSP, member's right to file an appeal, and time frame in which the member has to file an appeal. Once a member has exhausted Blue Cross Blue Shield of North Dakota's internal appeals process, the member has a right to a state fair hearing. Blue Cross Blue Shield of North Dakota will notify the member of a time frame in which to file the request. CSP administered by Blue Cross Blue Shield of North Dakota meets the requirements outlined in 42 CFR 431.54. Pre-certification. Pre-certification requirements can be found by visiting our provider website. Services requiring pre-certification are located at the website on the screen. Pre-certification submission is required through the Availity Provider Portal. Providers will request a pre-certification for a required service or supply by completing the appropriate request for the following: inpatient authorization request, outpatient authorization request, ABA services for autism spectrum disorder supplement. Please note, services not pre-certified will reject as provider liable with appeal rights. Prior approved pre-certification. For members who already have an approved pre-certification in place prior to the January 1st, 2022 administration change from Sanford Health Plan to BCBSND, will need to have a new pre-certification in place to continue care. BCBSND will allow 30-day continuity of care for providers to obtain a new approved pre-certification. Providers will have until January 31st, 2022 to obtain the new approval. Pre-certification requirements are listed at the website on the slide. Medical and reimbursement policies. Medical policies. BCBSND has developed medical policies that serve as one of the sets of guidelines for coverage decisions. Benefit plans vary in coverage, and some BCBSND plans may not provide coverage for certain services discussed in the medical policies. Coverage decisions are subject to all terms and conditions of the applicable benefit plan, including specific exclusions and limitations. This is in effect at the time the services are rendered and are also subject to applicable state and/or federal laws. Medical policy does not constitute plan authorization, certified coverage availability, or constitute a contract. Medical technology is constantly evolving, and these medical policies are subject to change without notice. We do try our best to provide notification of changes to our providers through healthcare news articles and/or letters. Additional medical policies may be developed from time to time, and some may be withdrawn from use. BCBSND reserves the rights to review and update its medical policies periodically without notice, and changes may not appear on the website. BCBSND makes all coverage determinations based on current medical policy or policies in effect at the time. Medical policies are not an explanation of benefits. Policies will identify whether they are Medicaid expansion, commercial, or combined. Reimbursement policies. This serves as another set of guidelines for coverage decisions. Reimbursement policies are similar if not directly aligned with CMS billing and coding guidelines. Coding and reimbursement policies can be changed at any time without notification. And as with medical policies, we do try our best to notify providers within 30 days. Policies will identify whether they are Medicaid expansion, commercial, or combined. Are you looking for the North Dakota Medicaid Expansion Provider Fee Schedule? You will need to access it through your online portal using your BCBSND credentials. BCBSND notifies providers 30 days before the effective date of any material modification of BCBSND's participation agreements. Notification will be 60 days before the effective date of annual fee schedule changes for the healthcare institution. Notification will be 30 days before the effective date of annual changes for healthcare professionals. Thank you.